Hello, in this video I will be talking about the front of the arm. The part of the free upper limb between the shoulder and the elbow joint forms the arm, otherwise it's also called as brachium. The deep fascia, otherwise called as the brachial fascia, forms the two modifications called as the lateral and medial intermuscular septum. So these two intermuscular septum, they are very prominent in the lower part of the arm, dividing the arm into two compartments, anterior compartment or front of the arm, posterior compartment or back of the arm. This intermuscular septum, which is prominent in the lower part, medial intermuscular septum, it is attached to the medial supracondylar ridge and to the medial epicondyle. So this intermuscular septum, it is pierced in the middle of the arm by ulnar nerve, along with it the ulnar collateral artery. From here, from the anterior compartment, these two structures, that is ulnar nerve and the ulnar collateral artery, it enters the posterior compartment of the arm. The lateral intermuscular septum, it is attached to the lateral supracondylar ridge, to the lateral epicondyle of the humerus. In the junction of upper and middle of the arm, this intermuscular septum, it is pierced by the radial nerve and radial collateral artery. So from here, the radial nerve from the posterior compartment, it enters the anterior compartment of lower part of front of arm. Talking about the contents of the anterior compartment, there are muscles, nerves and blood vessels. The muscles include the biceps brachii, coracobrachialis, brachialis. So these are the muscles belonging to the anterior compartment of the arm. There are other two muscles that take origin from the lower part of humerus, that is origin of brachioradialis and extensor carpi radialis longus. But these two muscles, they belong to the forearm. Nerves include the median nerve, the nerve of this compartment, that is musculocutaneous nerve, ulnar nerve, radial nerve. Here the ulnar nerve is seen in the upper medial 1/4 and the radial nerve is seen in the lower lateral half. Talking about the vessels, it has brachial artery and the venae comitans accompanying the artery and the branches of the brachial artery. Now the biceps brachii muscle. As the name is suggesting, biceps, bi means two. So this muscle take origin in the form of two heads, short head and the long head. The short head of the muscle, it takes origin from the coracoid process of the scapula. If you observe the superior border of the scapula, from there you see a bent beak-like projection, and this projection is called as coracoid process. So from the tip of the coracoid process, the short head of the biceps takes its origin, and this origin is always with the coracobrachialis muscle. Next is the long head of biceps. So this long head of biceps takes its origin from the supraglenoid tubercle of the scapula. If you observe the glenoid cavity, just above the glenoid cavity, you can see a tubercle called as supraglenoid tubercle, from where the long head of the biceps takes its origin. Remember that the long head of the biceps origin is intracapsular, means it arises within the capsule of the shoulder joint, but it is extrasynovial in origin. Insertion. So both this short and long head, it unites to form a single muscle. Then it forms a tendon that passes across the cubital fossa as a content of it. But this tendon twists so that the anterior surface becomes a lateral surface and the posterior surface becomes medial. The tendon is inserted to the posterior part of the radial tuberosity where the bursa is present, separating it from the bone. As the tendon is given, there is a small extension from the bicep that is called as bicipital aponeurosis. So this bicipital aponeurosis is the structure that forms the roof of the cubital fossa, and from there it runs downwards and medially and goes and gets inserted to the border of the ulna. Talking about the actions of the biceps. The biceps crosses the shoulder joint and the elbow joint, and also the superior radio-ulnar joint. So thus it produces action on the shoulder joint, on the elbow joint and the superior radio-ulnar joint. It is a flexor of the shoulder joint, stabilizes the shoulder. It is a flexor of the elbow, and remember, it is a powerful supinator of the forearm. The next muscle of this compartment is the coracobrachialis muscle. It is easy to remember the origin of the muscle as within the name itself contains the origin. Coraco stands for the coracoid process of the scapula. So coracobrachialis muscle takes its origin from the coracoid process, from the tip of it along with the short head of the biceps brachii. The muscle fibers passes anterior to the shoulder joint and it is inserted to the middle of the medial surface of the humerus. Since it crosses the shoulder joint anteriorly, it is a weak flexor of the arm. Brachialis is the next muscle of this region. So to see this muscle, we have to reflect both the heads of the biceps brachii. And the origin of brachialis, it embraces the insertion of the deltoid muscle at the deltoid tuberosity. Origin is from the lower half of anteromedial and anterolateral surface of the humerus. Insertion of this brachialis, it is to the anterior surface of the coronoid process of the ulna. So this muscle crosses the elbow joint anteriorly. Thus, it is a chief flexor of the elbow joint. The nerve of this compartment, it is the musculocutaneous nerve. So this nerve, it's a branch given by the lateral cord of brachial plexus having the nerve fibers C5, C6 and C7. This nerve pierces the coracobrachialis muscle, supplies the biceps and medial major part of brachialis, after which the nerve goes laterally and continues as the lateral cutaneous nerve of the forearm. The injury to the musculocutaneous nerve, the action affected will be the flexion of the elbow and the supination of the forearm are greatly weakened. Loss of sensation may also occur on the lateral surface of the forearm. About the artery of this compartment, that is brachial artery. The brachial artery is a continuation of axillary artery at the distal border of the teres major muscle. So the brachial artery lies medially, runs downwards, and we can see this artery as a content of the cubital fossa. At the level of neck of radius, the brachial artery divides into two terminal divisions, that is the radial artery and ulnar artery. The branches of the brachial artery given in the arm are the profunda brachii artery, and this artery forms the principal arterial supply to the posterior compartment of the arm. Nutrient artery is given to the humerus. The superior ulnar collateral artery and inferior ulnar collateral artery. These both arteries, they take part in the elbow anastomosis. The muscular branches that supplies the muscles of the anterior compartment. The terminal branch, as I mentioned, it is the radial artery and ulnar artery. Talking about the importance of this brachial artery, that is brachial pulse. So this is felt in the cubital fossa just medial to the tendon of biceps. It is considered to be one of the standard methods to record the blood pressure. So to feel for the brachial artery, you have to flex the elbow and hold the tendon of biceps. So that's how you feel for or hold the biceps tendon just medial to it is the brachial artery. Now about Volkmann's ischemic contracture. Injury to the brachial artery in the supracondylar fracture of the humerus. There will be compression of brachial artery, and because of which there will be interference with the blood supply. It results in ischemia. There will be fibrosis and contracture of the forearm muscles due to the loss of blood supply. Talking about the biceps reflex, it is important to test or examine the function of integrity of the C5 or C6 reflex arc. A change to the biceps reflex, it indicates the pathology at the level of the musculocutaneous nerve segment, that is C5 and C6.